Welcome. I am Melissa Cady, the owner of Painless Wellness, and I am a board-certified anesthesiologist and board-certified pain medicine physician. And I want to give you an idea of what to expect on the day of your general anesthesia at the surgery center. Now, the surgery center will call you the day before or a Friday before a Monday surgery to let you know what time you need to show up, typically about an hour to an hour and a half in advance of the scheduled surgery time. So make sure you know which one is which. And they'll have you come back to the pre-op area once they're ready for you after your arrival. They'll go ahead, one of the nurses in the pre-op area will go ahead and have you change out of your clothes and give you a bag for your belongings. And they'll go ahead and check your consent forms, check your blood pressure, all your vital signs, heart rate, all of those things so that we can have that already available to us. Of course, all of us will come say hi, and what I mean by all of us is myself, the anesthesiologist, or one of my trusted assigned anesthesia providers for your care, and the circulating nurse who is with you throughout the procedure in the operating room. Of course, the surgeon. So 3 of us are in the operating room at all times, and we will be looking out for your care that day. Now, once everyone said hello to you and we're ready to go back, typically you will receive a little relaxing medicine. I call it the IV margarita. I can go more detailed in that if you'd like to hear about that during anesthesia consult, or you can watch some other little videos that I'll probably have available to you as well. But once we get back to the room, most people don't remember going to the room, or once they get to the operating room, don't remember the operating room. Nobody is actually fully asleep. It's just their recall and their memory of that transportation to the operating room and getting the operating room is really not there when you look back on it. That's just the way the medicine works. But once you are in the room, we'll go ahead and place all the monitors on, let you breathe some oxygen. And once we're happy with the setup, then through your IV is how you fall asleep. You already have that IV in place. By the way, that IV is small. It's a size we can put in children typically, but that's an instrumental part for us to take you back to the operating room for adults and get you off to sleep completely after we're in the room with all the monitors on. Once you're completely asleep, then there'll be one of 2 different airway devices utilized to help you stay asleep with medicine that's mixed with the oxygen, and that'll keep you asleep while you're breathing it. One of the devices is a regular breathing tube called the endotracheal tube. That one goes through the mouth between the vocal cords typically, and anything from the lips to the vocal cords can get irritated. It's pretty rare to have any issues. Occasionally people might have a little sore throat here, or maybe the soft tissues based on the device we use to place that. Many times we use a video scope so we can see with a video a very clear picture of those vocal cords when we place that carefully. Now, the other airway device, which is typically used in cases where you're laying flat on your back and there's short procedures and there's no concern about bleeding in the throat and whatnot from, maybe facial type procedures. The device that's used is called a LMA, or laryngeal mask airway. It's like a soft plastic tube that just slips behind the tongue. So it does not go down to the vocal cords. It's strictly behind the base of the tongue, and that allows you to breathe medicine and the oxygen easily without obstructing, so that keeps your tongue out of the way and any soft tissues that could get in the way. So that allows you to breathe your own medicine. Of course, neither of these tubes are placed while you're awake. They are all placed while you're asleep when you need it the most. So once the surgery is underway, a lot of times the surgeons will place numbing medicine, so that'll help cover the areas that are having work, and so typically those things are numb when you wake up. If you need a little additional help, sometimes we can perceive that before you're even fully awake and can give you a little pain medicine in the background, and we can reevaluate in the recovery room to see if you need additional medicines. And of course, there's orders for the nurses in recovery to provide any of those medications. The numbing medicine is placed in during surgery in the operating room, so it's already in place. In addition, as anesthesia providers, we give anywhere from 3 to 4 anti-nausea medicines. That's the protocol we typically give our patients. Many anesthesia providers will provide 1 or 2 anti-nausea medicines in typical anesthesia out there, and that'll cover about 95% of patients if you're using the 2 standard ones. The additional 1 or 2 beyond that kind of takes it more to the 99% of patients that won't have any significant nausea. It's not always what you give that helps with nausea. Sometimes it's what you avoid. And sometimes if we don't have to use too many long-acting opioids, which can be notorious for causing nausea, that is sometimes what can really help patients in addition to some of the things we do to help treat nausea. So luckily, with a lot of numbing medicine and helping those areas that you have surgery on, that minimizes the need for us to use any long-acting opioids. So they kind of work hand in hand. One thing to know is that if your surgery is beyond 3 to 4 hours, it's pretty standard to place a catheter in the bladder. That is placed after your sleep, typically removed before we go to the recovery room, but those are things that allow your bladder to not be overdistended for too long and allow us to monitor your fluid status so we can administer fluids appropriately to help you out there. Once surgery is done and anesthesia is not needed anymore, we basically will turn off the medicine that you're breathing with that oxygen, and you'll just be breathing oxygen as you wake up. And it's pretty typical for most patients to wake up within 10 to 30 minutes after anesthesia is discontinued. And sometimes people, if it's a longer surgery, you're a little bit older, more sensitive. Sometimes it can be more on the longer side for some patients. But some people are really quick to wake up, 5-10 minutes. But everyone is individual and has unique responses to medication. So once we take you to the recovery room, usually people are in the recovery room anywhere from 45 minutes to 2 hours, again, depending on the length of your surgery. Anyone that's going to be picking you up that day, we typically give a phone call. The circulating nurse will give a phone call to whoever's picking you up or whoever you want to have updates with. We'll get a phone call after we get started with surgery, and then sometimes every 2 to 3 hours, and then eventually from the surgeon, and eventually you will get a phone call from the recovery room nurse, usually 15 to 30 minutes before ready to go home. So that will be dependent on how quickly the patient wakes up and whatnot. If you have any questions or you've had some questions come up along the way as you've been listening to this video, please write them down. We'll be happy to answer those during the anesthesia consult, whoever you've been assigned to, whether it's me or any of my other trusted anesthesia colleagues, and we'll look forward to taking care of you.